Hi guys, how are you doing? I hope you are well. As I promised in this session that we are going to learn about how to do a breast self-exam at home so that we can make early diagnosis of any breast problems like cancer or any other problem that may need medical attention. Okay, so I want us to know how we can do a self-breast exam at home. Yes, from the comfort of your home. Okay, so a number one point is that a regular examination of your breast can be an important way to find breast cancer early when it's more likely to be treated. Okay. A regular breast exam can be an important way of early noticing of breast cancer and when it can be more likely to be treated. Okay, so early diagnosis, early treatment, good outcome. Okay. So number one, we have what we call visual inspection. Okay, that is just using your eyes to notice any problems in your breast. Okay, so number one, what you do, you stand in front of a mirror. Okay, stand in front of a mirror and then with your shoulders straight and your arms on your hips. Okay, you stand in the mirror straight with your shoulders straight and your arms on your hips like this. Okay, and then now you look at your breasts in the mirror. Sorry. So what do you look for? What do you look for? Number one, look at the size of your breasts. Okay, are they of the same size, both of them? Okay. Number two, we have shape. Look at the shape of your breast. Okay, is it the normal shape that you know of your breast? Are there any changes in the shape of your breast? We have color. Look at the color. Look at your nipples. Okay, look at the pigmented area of your nipples. How is it? Is it okay? Look at the nipple changes. Look for nipple inversion. Is your nipple inverted? And then look for any mass that you can see in your breast. Okay. Look for the color. Look at the color of your breast. Okay, the skin color, any rash, any swelling. If you notice that there's any changes in the size of your breast, the color of your breast, your nipple is discharging some fluid, your nipple is inverted, there is color change of your breast, seek medical attention as early as possible. Okay, so the number one way you can inspect your breast is by just looking at it. Visual inspection. Stand in front of a mirror, put your arms down straight or at your hips. Look at your breasts in the mirror. Check at the size. Are they of both of the same size? Shape. Check for look at the nipple. Is it inverted? Is it okay? Look at the color. Okay. Check for any rashes. Look for any mass that is in the breast, and if you find any, you need to seek medical attention. Number two, we have raise your arms and look for the same changes. Okay, we said you stand, you put your arms in the hips or straight. After you finish, then now you can raise your arms and then check for the same changes that we have talked about. Number 2, we have manual inspection. Okay, now this is when you use your fingers, okay, to feel for any lump inside your breast. Okay, so in this, what do? You lie down on your back. Lie down on your back in your bed in a firm surface. Okay, let's say in your bed, if your mattress is firm. If it's not firm, you can look for some place that is firm. You can look for maybe on a table, any place, any surface that is firm, or you can even put a mat down on the floor and lie down on your back, using your fingers. Okay, using your fingers. Use your left hand to feel on your right breast. Okay, using your fingers, round motions. Feel for any lump in your breast. You start from the nipple point and go round your breast as you come to the outwards. Feel for any mass. Use your left side to feel the right breast. Use your left hand to feel for the left breast. Okay. Feel for any lumps. Okay, using your fingers. Touch smoothly in a circular motion. Okay, starting from at the nipple point, coming round to the outside. Okay. When you are down, feeling when lying down, now you stand up. Raise your hands up. Okay, repeat the same procedure. Use your right hand to feel the left breast. Also repeat the same procedure when you are seated down. Okay, so do breast exam every month. Okay, do it on a monthly basis. Just make it a routine. Okay, and you can make it easier. Do it when you are in the shower, or when you are dressing in the morning to go to work, or when you are undressing in the evening to sleep. Okay, so do it monthly, so that early diagnosis can be made, just in case there's any problem. Okay, so when to see a doctor? When are you supposed to see a doctor? Number 1, when you feel a lump inside your breast, when you see nipple discharge and you're not a lactating woman, when you see an inverted nipple, or a rash, or a mass. If you notice dimpling, you notice that some part of your breast is just has a dimple. Okay, we have a change in the look of the nipple. Okay, check for the pigmented area of the nipple. How is it? Are there any changes? If you notice dark spots on the skin of the breast, if you notice any swelling on the breast, and also if you notice any changes in the size of the breast, that is when you are supposed to see your doctor or to seek medical attention for any intervention if need be. Okay, yes, that is the simple way in which we can do a breast exam. Okay, early diagnosis leads to early treatment, and early treatment leads to good outcome. Okay, so thank you so much for watching. That is it. Please remember to subscribe, and see you in the next session of learning.